Congenital malformations. The external ear means auricle plus external auditory canal. Anotia means absent auricle. Microtia, small or malformed auricle. External auditory canal atresia, absent external auditory canal and tympanic membrane. Congenital external auditory canal stenosis, narrowing of the external auditory canal, not surfer ear. External auditory canal duplication of part or all the external auditory canal. Here it is congenital canal stenosis. This is not surfer ear. Surfer ear will be explained later on. There is narrowing here, focal narrowing of the external auditory canal. Please compare both sides, right and left. Don't forget, have a look on the external auditory canal, compare between both sides. Microatia, here it is, you will find it, have the 3D and the volume rendering. It is very helpful. You may not be aware of this pathology. It may not hit your eyes, but here you find it is very clear, and you will not lose plenty of time to have this reconstruction. CT images demonstrate a small and malformed right auricle. In addition, the external auditory canal is absent. Here it is absent, and the external auditory canal is present here, and there are no ossicles in the middle ear. Foramen tympanicum, it is defect in the antero-inferior aspect of the external auditory canal. It could be a bit full, as you can call it fracture if there is a history of trauma. It facilitates spread of infection. It can fistulate into the parotid and synovial TMJ. The ear injury, don't forget, can cause ear injury, because this is a defect, can cause ear injury during TMJ arthroscopy. It is very rare. Here it is, but still, if you have a background, have a look on the other side. If you have a background, please, it is better than call it a fracture, and if it is not a fracture, it may be something embarrassing if you don't have this background. Coloboma oris, actually, some children, I saw it once in my life. One of the children, I saw him has a defect in his very small hole in the skin, and this can be asymptomatic, but there is a family rule, and through this canal can be complicated and infected like that. There is here, it is cyst, but it can with time, it is susceptible to infection, and here it is some edema and some realm of enhancement. Here it is high signal because of this coloboma oris, which present in a small opening anterior to the ear helix and tragus. Next is cavernous hemangioma. When I say soft tissue hemangioma, search for one thing, philoboli. Then the pattern of enhancement. Non-contrast CT, philoboli, it is soft tissue hemangioma. And long history. Unless it is a newborn in the orbit. But generally, when you listen to hemangioma, it is search for the philoboli. Okay. In the T2, it is high signal, T2 shine through, heterogeneous in the EDC, centripetal in the post contrast peripheral, and then central towards centripetal enhancement. But the most important finding is the philoboli. Okay. Trauma. Don't forget, have a look on the external auditory canal. It can be injured, either isolated or associated with petrous bone fractures. Okay. Osteoma. It's very important because it happens, and for me, it is not uncommon. It is benign pedunculated bony outgrowth, and usually on the bony cartilaginous junction of the external auditory canal. Asymptomatic and usually incidental finding. Surgical excision, if symptomatic, unilateral. And don't forget to look for secondary cholesteatoma if large lesions. Okay. And the second pathology, which is similar to osteoma, is exostosis, which is benign outgrowth with a broad base of the osseous component of the external auditory canal. Surfer ear, common in the swimmers. These are the common narratives about the history. Surfer's ear, usually in response to cold water exposure, commonly bilateral, osteoma unilateral. Medial portion of the bony external auditory canal, the osteoma at the junction between the cartilaginous and the bony part, results in different grade of external auditory canal stenosis. Here it is, osteoma broad-based. Here it is broad-based, and the exostosis is pedunculated. I think there is reverse between each other because there's a broad-based. Here it is, this surfer ear, this is osteoma, and the surfer ear is bilateral and osteoma unilateral. Osteoma is at the bony cartilage junction, and here osseous part of the external auditory canal. And here is the surfer ear, cold water exposure, and here it is. Look for secondary cholesteatoma. So this should be reversed, and they will be reversed on the presentation saved on the side. So these should be osteatoma and these should be exostosis, but the details underlying both of them are true. Here it is, the surfer ear, swimmer, cold water, bilateral, osseous part of the external auditory canal. On the other hand, the osteoma unilateral, pedunculated, could be asymptomatic, bony cartilaginous junction, search for secondary cholesteatoma. External otitis, this is some inflammation of the external ear. It is very common to have that. The problem all the time, the problem with the swimmers, unfortunately, this something cannot be solved because the swimmers most of the time are immersed under the water. So the very high possibility for repeated infection with external otitis. Necrotizing external otitis. When I say necrotizing external otitis, let these words ring in your mind. Diabetic or immunocompromised. Diabetic, immunocompromised. Pseudomonas aeruginosa. It's very important. Destructive, very destructive. But believe me, if you don't have a look at the external auditory canal in your study, you may miss it. Believe me, whatever there is a high possibility to miss it if you don't consider it in your checklist. Okay, CT is very important as a starting assessment of the petrous bone generally, but CT could be present as phlegmon or the complication, the abscess, and this abscess can extend intracranially and have many complications, intracranial complications. Okay, and these can cause skull base osteomyelitis. In the MRI, it is inflammation, phlegmon, low T1, heterogeneous T2, heterogeneous enhancement. If there is organized abscess, 12 marginal enhancement. Okay. Here it is examples for the malignant otitis externa or necrotizing otitis externa. You will find here diffuse phlegmon inflammation. The inflammation here, there is expansion and the bone erosions. Different. If you see it, you never be confused. It is malignant otitis externa. Yes, ask the patient, ask about the history of the patient, diabetic in that region. What will be the pathology? Either from the external auditory canal or from the TMJ. So it is, and the history and the flaring, all of these favor malignant otitis externa.